Hi, I'm Tamnotkini Fubara Omopepo. I'm a 400 level law student of River State University, the last of 4 kids, and I'm the founder of Sickle Cell Awareness and Health Foundation in Port Harcourt here. Sickle Cell Health Foundation was founded in 2018 due to the fact that I didn't like the way and the idea of sickle cell in Nigeria. I wanted to change the narrative, so I decided to start something. And we started from a WhatsApp group. Then we started having outreaches, blood drives, and we started reaching out to other sickle cell patients out there. During the corona period last year, August, I was experiencing a sharp pain below my abdomen. Then went for a hospital visit in a federal hospital and went to ONG unit, that's gynecology. There, I got to meet the doctor. He did a normal checkup and everything. Then he examined me and said that we have to do emergency surgery. So, due to the fact that I have sickle cell, we have to look for blood before I go into theater. So my sister has to call her contacts that we have from our foundation, the Sickle Cell Awareness Foundation. We got the blood and we're ready. They actually wasted so much time. The blood was ready by around 1, 2. We had to wait till around past 8 before I was taken into the theater. So got into the theater and they were asking, have you paid theater fee? Have you paid this fee? Have you paid that fee? Like, those things are things that you're supposed to be settled already, either before that or after the surgery. Then during the procedure, they were not like, you have to buy everything that the doctors are going to use for the procedure. You have to buy their clinical wares, the glove, the syringe, everything. And that's not supposed to be so during this kind of critical moment. I think this thing should be already there. I think the government should actually provide those things. But we had to get those things first before they actually started. So they started the procedure. It was local. They didn't give me anything to eat. They didn't give me any anesthesia to sleep off. So just injected in my spinal cord. And after a while, I felt numb from my abdomen down. Then they opened and they found out it was a ruptured ovarian cyst, because before we entered inside the theater, they didn't really know what was that, but just said that they had to operate immediately. So we got to know that ruptured ovarian cyst, which actually happened due to my hormonal imbalance from this whole sickle cell thing. When I started seeing my period was not stable from the beginning. For my 17 years, so my period never stable. It comes this month, then it skips like that. So there was always fluctuations. I never knew all those things were just piling up and were harmful. So I got to understand that in that hospital, everything that you're doing has to be paid for, even as much as they'll tell the public that they are paying, that the government is paying for certain things, but it's not actually in reality. You get to pay for everything you're doing, and that's not supposed to be so. Like, we should be able to access good health care that is effective and efficient.
So surgeries are supposed to be done only when what is due diligence, quote unquote, has been thoroughly carried out. So as part of due diligence, the surgeon is supposed to do the clacking of the patient, do all of the necessary investigations. The anesthetist is supposed to also come do his clacking or her clacking, do all of the necessary investigations. And they're supposed to liaise with the management of the hospital to find out if this patient is a cash paying patient, and if this patient has paid all of the necessary card, particularly if it's not an emergency. The standard is that if it's an emergency, they are supposed to get into the theater and attend to the patient as quickly as possible without necessarily requesting for money, where all things are working well. But if it's not an emergency, if it's an elective case, for instance, you did all that was necessary first to to ensure that the patient are taking care of all of the administrative things necessary for that surgery before you wheel that patient into the theater. You know, what she has just shared with us is quite unfortunate, and it may have resulted into what we would have said, into mortality, because of the fact that certain people who are not trained to do certain function within the hospital environment took on those functions. The surgeon, the doctors are not supposed to be speaking the lingua of money around the hospital. So where the hospital is properly structured, you are supposed to have those people in authority that are supposed to liaise with the patient for everything administrative. So why should patients pay for theater gowns? Why should patients pay for all of the sutures, that you are going to use in the theater as soon as you want to do the procedure? All of these things should have been done long before the patient is wheeled into the theater. So it speaks to the fact that there is need for reorganization of the entire hospital system, the entire healthcare system in our country, starting from the primary healthcare centers up until the tertiary centers, concentrating even on the private hospitals that you have scattered across the states and scattered across the country. We must ensure that what must be done regarding dividing the hospital into the clinical sector and the administrative sector must be enforced for all of the hospitals across the country. Whether it's a teaching hospital, whether it's a private hospital, the administration must be different from the clinical, and everyone who is within the clinical must not speak the lingua of administration. Everyone who is in administration must not speak the lingua of the clinical section. If you would have hospitals run like that, you can be sure that we would not have all of these challenges like was just mentioned. My complete heartfelt apologies to as many as may have been confronted with this kind of negative story or negative whatever about the hospital system. My apologies, because I'm a stakeholder who is interested in righting the wrong in this sector.